an example of a patient that we are going to start ventilating. So I have a ventilator here called the Trilogy, and it's supposed to be it can be used as a non-invasive. So this would go on the patient's face, and then you could use this for either CPAP or BiPAP, which we really should call bi-level, BiPAP is a trade name. But if we do need to convert this to an invasive ventilator, I'm going to show you how. So notice there's just a single circuit, and this circuit can then be connected directly to the patient's endotracheal tube. And in that scenario, it's going to be this connector right here. So from the mask to the endotracheal tube. Now I'm going to turn on the ventilator. Notice how our lungs are going to start inflating. Okay, so they were absolutely de-recruited, and now they're going to start recruiting. Okay, so they're going to start inflating. So what I have here on my ventilator is I have the settings of a patient that would be what we call the ST mode, which means spontaneous times. Then we have them on bi-level ventilation. So here I have them in a pretty high setting. So I have them, we're going to put that down. So if you were going to start at an ARDS patient, you might want to start about 25 over, we could try it with 25 over 12. That would give us a driving pressure of 13. And then the breath rate of 25 and an I time of 0.8. Okay. So I'm going to move this so you can see my settings a little bit easier here. Okay. And notice we're going to inflate the lungs. So we have on a rate of 25, a high pressure of 25, a low pressure of 12. And just for some examples here, I'll show you what the importance of PEEP could be. So I will, here in my settings, turn down my PEEP all the way to the lowest I can get here, which is 4. Okay, so now you can see how much more de-recruited the lungs are. And when they're de-recruited, meaning they're not inflated, your patients are going to have a hard time with oxygenation. When you have an ARDS patient, it's really important to use a lot of PEEP with them. So recommending here on this low pressure, start that at about 25, the high pressure at 25, low pressure about 12, giving you a driving pressure about 13, which is what we would like. And now you can see the lungs stay open, even on exhalation, a little bit better. Good. And once again, we want a higher rate around 25 and a I time of about 0.8 seconds.